What does an HSG test show about your uterus? Imagine trying to understand what's happening inside your reproductive system without surgery. That's where the hysterosalpingogram, or HSG, comes into play. It's a special X-ray test that helps doctors see inside your uterus and fallopian tubes. This test is especially helpful if you're having trouble conceiving, as it can reveal issues that might be blocking or affecting fertility. During an HSG, a small tube is gently inserted into your cervix. A contrast dye, which contains iodine, is then carefully injected into your uterus. This dye makes the inside of your reproductive organs visible on X-ray images. As the dye flows through your uterus and fallopian tubes, the doctor takes X-ray pictures to see how the dye moves. If the dye flows freely through the tubes and fills the entire uterine cavity, it suggests that these structures are open and functioning well. If the dye doesn't pass through or pools in certain areas, it could mean there's a blockage or abnormality. The HSG provides valuable information about the shape and size of your uterus. It can show if your uterus has a normal shape or if there are structural issues like a septate or bicornuate uterus, which are congenital abnormalities. It also detects intrauterine abnormalities such as fibroids, polyps, or scar tissue inside the uterine cavity. These issues can sometimes interfere with implantation or increase the risk of miscarriage. However, it's important to note that an HSG isn't designed to diagnose conditions outside the uterine cavity, like endometriosis, which affects tissue outside the uterus. While the HSG doesn't directly diagnose endometriosis, it plays a key role in fertility assessments. For women with endometriosis, understanding the condition's impact on the uterus and fallopian tubes can help guide treatment options. If the test shows blocked tubes or abnormal uterine shape, addressing these issues might improve chances of conception. In summary, an HSG test shows whether your fallopian tubes are open and if your uterine cavity has normal shape and structure. It helps identify potential causes of infertility related to blockages or abnormalities. Always remember, results can vary from person to person, and your healthcare provider can interpret your specific findings and suggest the best next steps. If you're considering this test, consult with a fertility specialist or your doctor to understand how it fits into your overall fertility evaluation.